As we've been reporting, staffing across Pennsylvania's child welfare system is so strained. Caseworkers burned out. Organizations that provide services like therapy, addiction help, and parental support are also short-staffed.
As CBS 21's Jessica Babb shows us, it's limiting the services they can provide.
In Pennsylvania, there's an emphasis on keeping kids in their homes or reuniting them so they can maintain their community. But as child welfare organizations have fewer staff members, wait lists, and limited services, I'm asking if kids are being put at risk.
It's been pretty tough. You know, the pandemic really shook a lot of things up.
Shaking up the system and showing its cracks.
Even though our wait lists are high, I think the demand continues to increase. You know, that demand has not gone away. I don't want to be doom and gloom, but the light at the end of the tunnel is not quite there yet.
For kids in the child welfare system,
The best chance that kids have to be reunified is to make sure that that child and that family have the resources that they need.
whether that's behavioral health help, substance abuse and parenting support, or other services, they're resources that help provide a safe and stable home both before and after a kid is reunified, or preventing them from being removed in the first place. Some providers, like Merakey, also place children in foster homes. Merakey has 112 homes statewide. And you said you'd love to see almost double in the number of foster homes that you have?
Yes, because one, the need is out there.
Kim Caton, Merakey's director of operations, says she's heard of instances where kids who've been psychiatrically hospitalized have no place to go once they're discharged from the hospital, which means others are waiting for those services to be freed up.
But they have no place to send the kids, so the kids are just stuck.
Not to mention, with staffing strains and turnover, a tough job is getting tougher.
Well, obviously we have wait lists. So if you're calling in for art therapy, you're going to wait anywhere between 30 and 90 days, depending on which center you call into.
We're regulated in the number of cases that a staff member can carry. It results in kids not getting the services that they need.
At Children's Aid Society in York, in addition to a youth home and other services, they operate one of the few crisis nurseries in the Commonwealth.
When we don't have staff to be with the kids, we can't be open.
What happens when a child can't access those services on a certain timeline?
Well, I think what it does is it puts that strain back on that family. They're coming when they can't take it anymore, and then to say to them, you have to wait 90 more days before we can help you is a real difficult challenge.
If both parents and youth are waiting for some of these services, can it delay reunification?
Absolutely. I mean, one of the best indicators of successful reunification is a stable placement. But if you have a child who is placed in a foster home and they have, say, behavioral health needs that aren't being met because they're on a wait list, the odds of that child's placement being disrupted go way up.
Are we potentially putting kids in an unsafe situation or putting them at risk if we're reunifying them without all of these other supports in place?
Yeah, I mean, the last thing you want is to reunify a family and then have it disrupted again because something was missed, the first time around. So, and I know the family courts are usually pretty careful about that, as are the child welfare systems. But it's that now you're just creating a logjam because we don't want to send this kid back quite yet because they haven't received what they need yet. But at the same time, there's a kid who's waiting for that.
What's the answer to avoid kids falling through the cracks?
I mean, more services and more service providers, which unfortunately means more money, which, everybody's trying to figure out where to get it from. And there have been a lot of funding opportunities that have opened up, at the federal and the state level. So I do think the system is recognizing the need and trying to catch up, but change on this scale takes time.
Both Merakey and Children's Aid Society have been doing what they can to recruit staff, including increasing salaries and benefits and focusing on staff development. For CBS 21, I'm Jessica Babb.
And if there's a part of the child welfare system you want us to look into, call Project PA's Children in Crisis tip line at 717-857-3613.